When I was in training, I knew that I loved learning about how the brain worked. And one of the ways that I was interested in looking at how the brain worked was dementia cases. So I also happen to really love psychiatry and hearing about people's stories. Every person's story is different. So geriatric psychiatry was just a way that I could combine those two passions of mine. So what I do on a day-to-day basis is I take care of people who have memory problems. And so that involves things like making diagnosis and managing the memory problems. But I also hope that my psychiatry training can bring the mental health piece into it as well. A lot of people, when they're going through memory changes, experience anxiety, depression, amongst other mental health challenges. Most of the time, people come because they have been feeling like they have noticed some changes in their memory. So either they themselves have noticed it or their family member has noticed it and are urging them to come in to get an evaluation. That can be a scary visit for a lot of patients. My first priority when I see a patient for the first time is to make sure that they're comfortable and that they feel that they can be open with what they're experiencing. Aside from the standards of, understanding what they've been experiencing and getting enough information to come to a diagnosis and management plan, the other aspects that are really important in memory care is understanding what's important to the patient. One thing that's unique in dementia care also is the involvement of the family. So memory is one of those things where sometimes other people notice things before we do. So the input of the family is really important, not only for coming to a diagnosis and a plan, but also kind of thinking forward and how we're going to manage things as a unit. The most rewarding part of the job is being able to provide some guidance for patients and their families. I often hear from patients and their families that they may have been seeing this problem go on for a few years, but not understand what's really happening. So even just having those initial steps and a plan can be very comforting.